want you to take it twice a day, and go get that evaluation. That I also print up the name of that medicine for you to talk to the neurologist about, because I think that workup needs to go. And I'm going to give you some.
I think I just saw him when I was swimming, but I don't see him. I see the nurse lady.
No, I want you to see Mayo Clinic.
My concentration's gone to hell. My focus has gone to hell. It pisses me off.
How much weight have you lost? Any?
148 is how much I weighed on my home scale.
Mm-hmm.
I got on it this morning. That's 129. And that would be since the 16th of April. I just, the eating thing, I live right. So I have, the smoothie, the milkshake. Because, if you have to chew, it's like, chew twice, breathe. Chew twice, breathe. It hurts. I'm sitting there going, why can't we take some of this blood off my thighs, and put it up here? Because up here it's just bony as I think. So I see there's a 6-pound difference between, my scale high quality. I got it at Walgreens.
That's probably enough.
Keep your mouth open. Okay, that's fine.
I don't have much strength.
With the choreic disorders, the constant random kind of movements, patients either are unaware or underestimate how bad their movement disorders are. Whereas patients with tardive dystonia are very much aware of their syndrome.
Turn sideways to me. That's right. No, that's perfect.
Dorothy has these involuntary movements of her arms, particularly her left arm. But the major problem here was the arm and the axial dystonia, so that she's leaning backwards.
Just going by itself, huh? Can you hold your hands out in front of you? Both hands?
During this entire time, her psychosis was completely controlled. But they weren't able to find any other medications that could treat her. And she was intolerant of reserpine that induced a severe depression. She was placed on clozapine, which actually did nothing at all for her movement disorder. And the rationale for using clozapine was to allow this passive healing business and also hopefully to treat the tardive dystonia, but it really didn't treat the tardive dystonia. But when we added reserpine, she was able to tolerate it this time, and she became dramatically better.
This 76-year-old woman has a 2-year history of tardive orofacial stereotypies related to an 8-year treatment of chronic nausea with phenothiazines.
How old are you?
77.
And what is it that's bothering you the most?
My mouth.
How long have you had the problems with your mouth?
Well, I guess about a year and a half.
How long?
About a year and a half.
Okay.
Acute dystonia. Acute dystonias are characterized by involuntary, sustained, painful muscular spasms affecting the neck, jaw, eyes, tongue, or trunk. Typically, they're caused by antipsychotic medications acting on dopamine receptors. They are more common with the older generation antipsychotics. In this clip, you will see an older woman being examined. She presents with acute dystonia. In her case, a spasmodic torticollis.
Okay, I've been asked to come and see you because you've got a problem with the muscles in your neck. Can you just tell me what's happened and how it's come about?
Well, it came on, I don't know, 15, 20 minutes ago, just after they gave me an injection of something.
Okay.
And I've been like this since.
Has it got any worse, or has it just stayed like this over the last few minutes?
Feels locked.
Okay, let's have a quick look. Okay. Can you move your head straight at all?
No.
No, okay. Try and relax as much as you can. We can give you something for it, but we'll take it away in just a few minutes, okay?
What is it?
It's what's called an acute dystonia. It's a reaction to that injection that you had, which does sometimes occur, but we can treat it very easily, and it means we've just got to be very careful if you do need the same medication again.
Catatonia. Catatonia is a state of increased muscle tone at rest, which is abolished by voluntary activities and therefore distinguished from extrapyramidal side effects. In these clips you'll see a variety of forms of catatonia demonstrated by a role player being examined by a psychiatrist. This clip shows force grasping, where a patient is unable to comply with instructions to resist a preferred handshake. Characteristically, the interviewer has difficulty getting his hand away.
Just want to move your arms around a little bit, is that okay? Okay. Okay, just leave go. Just relax a second. What I'm going to do, I'm going to put my hand out, but I don't want you to shake it. Okay, leave go. Think carefully about what I'm asking you to do. When I put my hand out, as though I'm going to shake your hand, don't take it. I do not want you to shake my hand this time. Okay, that's fine. Just try and relax for a second.
In this clip, waxy flexibility is demonstrated when a patient's limbs are placed in an unusual position, where they remain for a sustained period.
I'm just going to move your arms gently. You said that you feel that there's something not quite right. You're having some difficulty explaining that.
The patient in this clip is displaying opposition, resisting all attempts by the examining doctor to move his arm.
I'm just going to move your arm gently. Just let it come with me. Okay, that's fine. That's fine. I'll try and pop it down this way now. Okay, that's fine.
A more intense form of opposition is negativism, where the patient actively resists all attempts to make contact and also, in this clip, displays aversion by turning away from the examining doctor.
I'd like you to just shake my hand. Okay. And shake my hand, Peter. Okay, we'll leave that for now.
Like a warm candlestick, the body of the patient can be contorted into almost any posture. The patient may maintain the posture for several minutes.
During the Middle Ages, and later to describe the abnormal gait and stance of patients with Sydenham's chorea. We now use the term chorea, however, to define a class of abnormal involuntary movements. Choreic or choreatic movements consist of individual, brief, purposeless, non-repetitive jerks of individual muscles. These tend to be rhythmic and non-patterned, but they appear in series or groups, which result in rather complex movements. The movements are made more complex by the patient's attempts to mask them by purposeful movements. Here we have a patient with fairly severe choreatic movements involving various parts of her entire body. Here we see movements involving the jaw, the tongue, the mouth, the neck. Each is an individual, brief, sudden, purposeless jerk. In this individual, the choreatic movements are due to Huntington's chorea. The individual movements, however, look the same no matter what the etiology of the choreatic disease.
During infancy, this girl suffered damage to a small area in the region of the basal ganglia on the right side. In this slow motion picture, you can see that she is afflicted with gross abnormal movements of the left arm and leg. These are most readily evoked by emotional disturbance. Yet in spite of them, she is able to coordinate the movements of the right arm and leg and drink from a tumbler.
Describe another form of abnormal involuntary movements. The movements of HEMIBALLISMUS involve the arm and leg on one side and are usually contorting and continuous and of a rotatory nature. HEMIBALLISMUS also merges with hemichorea. The abnormal involuntary movements of HEMIBALLISMUS usually come about as a result of a CVA. The lesion usually involves the subthalamic nucleus or corpus luisi, but can also involve the globus pallidus or the connections between the globus pallidus and the subthalamic nucleus. Here we have a patient with relatively continuous, severe contorting movements of his right side, involving the arm not quite as much as they do the leg. We see the continuing rotatory movements of his right leg.